Welcome to this episode of Health Digest. This May, we are talking about cancer diagnosis, treatment, and management. On our first episode, we looked at cancer diagnosis, how cancer is diagnosed, how doctors get to make that diagnosis from when you present to the hospital up to the point where they give you that diagnosis. And we know that for most Kenyans, cancer is diagnosed often when it's too late, when treatment options are really limited and may not offer much options for the patient. And in this episode, we'll discuss what those treatment options are, and we'll start with the radiotherapy. Now, I sat down with Dr. Catherine Nyongesa, who's a medical oncologist, and also with a radiotherapist and a medical physicist who took us through cancer radiotherapy. Also, in this episode, you'll get to hear some of the stories of the patients who've had to go through radiotherapy or even a combination of radiotherapy, chemotherapy, and surgery just in a way to manage their cancer. So we start off this episode from the radiotherapy session. At Texas Cancer Center, we meet up with Pamela and Geoffrey Asango. Geoffrey is 58 years old and last year was diagnosed with sinusoid cancer.
I noticed that I was losing the ability to hear from my left ear. Then, thereafter, let us say 2 months after that, I noticed also that my nostrils were blocked.
What did you think about all this when you had all these symptoms? What were you thinking it could be? Did it at any one point occur to you that it could be cancer?
No, not at all. What I had in my mind was sinus. Sinus, nasal congestion, only sinus. That's what I had in my mind. Mm-hmm. I noticed that it was becoming persistent, and after using so many drugs, with no improvement, then ENT suggested that I should go to Nairobi and have my scan done, and it will reveal what is mainly ailing me. A series of scans were done, and biopsy. That's when it was revealed to me that I had cancer. Yeah. I was prescribed. I'm recommended for radiotherapy and chemotherapy.
This is your third session.
Yeah.
Just like yesterday.
Yeah.
We'll do the same thing. The setup will be the same.
Yeah.
For the next 27 days, you'll be lying here until we tell you to break a little bit so that they can change the field.
Sure.
So what you do, you just remove your jacket, and you remain bare chest.
What about my shoes?
Yeah, remove your shoes also. Lie on your back. Okay, go. Mostly we treat with the patient supine. So it's the most comfortable position, one. We use this called headrest, is an immobilizing device for the comfort of the patient. And we try to make sure that the patient raises the chin because it's the best position so that we can get the spine straight, especially when we are treating. Because at some point we'll have to reduce the field of treatment to a smaller field that's away from the cord. Because when the cord receives some radiation, some up to 44 grays, you use grays, then it will be on a danger side. Especially 46 is the maximum, but here we do 44, and then we cone down, we remove the radiation from the cord. We use laser beam. Laser, these lines, to position the patient so that we make sure that the patient is straight. These laser beams, we make sure that the patient is straight. These are our positioning lines. Yeah. So we have the longitudinal, and we also have lateral beams. You can laser beams. You know, you're standing next. Oh yeah. You see. So this is what we use.
Can you explain using your shirt because they are on this side?
These are laser. Is a laser that can this is a line. It's called a laser line or a laser beam. It can be found on in air. That's why we use it, especially in positioning, so that a patient can be very, very straight.
So the red one positions
longitudinally, and this one,
the green one,
or axially.
What are these numbers that we can see here?
These numbers, you see, when you are treating using this linear accelerator or even cobalt, when you're treating, you have to treat a specific distance. So from the source of radiation to the surface of the patient, it's either 100 or 80.
Radiotherapy is the use of high energy X-rays to treat cancer. So those rays just focus where the cancer is. And there are different machines which can generate these X-rays. For example, a linear accelerator, or you can use a cobalt machine.
How do you decide? Because talking to patients, they're like, I've been told 33 cycles or 25 cycles of radiotherapy. How do you decide how many and what grays to give to a patient?
Okay, these are, when we decide the dose of radiation, it's like medicine. So there's a lot of research which has been done in terms of guiding the doctors on how much dose of treatment to give. So in the past, we had, radiation has been around for over 100 years. So there are a lot of studies and also clinical experience. You'll be surprised when radiation was starting, the doctors used to use it for arthritis, for mashilingi, they could treat with that one. Then they realized, radiation has some dangers. And then when they started treating cancers, they could give a specific dose and wait for reaction and for side effect and for improvement. So with all that and running phase 1, phase 2, phase 3 studies, they've come to acknowledge that radiation should be given this amount spread over specific days.
At that point when the doctor says it's cancer, what did you feel?
The doctor was a good one because he had taken me through the steps. He had asked me, what of you noticed, you realized that it was cancer. How will you feel? How will you accept it? Then I was very much prepared for it. Then when the news just came out, the test showing that I was cancerous, I was not, I didn't feel bad. I just took things the way they are. I was taken through the necessary tests, what have you. Then I was prescribed, I'm recommended for radiotherapy and chemotherapy.
So have you done the chemotherapy?
Yeah, chemotherapy.
How many?
I have already done 1 and remaining 6. Radio, I've done 3, remaining 30.
When you're told you'll do 33 cycles of radiotherapy, what did you think about radiotherapy?
Right.
Before you knew what it was.
So I said, this confirms my that I am on a deathbed, because 33 is quite too many. So I said, I'll endure, but shingo upande.
Esther Nzoli and Florence Makoha are 2 other women who have had an experience of going through radiotherapy. This is after being diagnosed with cancer. Esther had even gone through a surgical procedure.
Me, I went through the report. Okay, some languages you cannot understand if you are a layman, but others, the last paragraph, actually it was showing there is a tumor. And then CA. So me, I said no. CA must be cancer. I was to take chemo, 6 chemos, and then 28 sessions of radiation. Ambapo the radiations, I was doing the sessions every day. And then the chemos I was taking once per week. So I took almost 3 months, the treatment.
You find we give radiotherapy like daily, allow time for the patient and the normal duties, normal tissues to recover, because when you focus radiation, there's a chance that normal tissues will be affected, but the normal tissues recover very quickly. So when we allow time like for 6 hours or more, you find the normal tissues start recovering and the patient is ready for the next treatment the next day.
Kabla uanzishwe radiotherapy, kuna maono yoyote ambayo ulikuwa nayo kuhusu radiotherapy na side effects zenye ambazo zinaweza kuwa wewe mwenyewe ulikuwa unafikiria inaweza kufanya nini?
Vile watu walisema nilifikiria wanachoma, inaweza kuchoma usikie uchungu, lakini kumbe hapana.
Did you have any idea of what chemo and radiotherapy is like?
No, I didn't know. No, I didn't know.
Out there they say, oh, kuna kuchomwa, unaenda kuchomwa. So the first day the patient comes in is there's too much anxiety because they want to feel that heat. So once you treat the patient and you tell the patient you are finished, the patient starts wondering, but hujanichoma sijasikia moto, you know.
They come and they think that when you go for radiation, you are going to burn, that it's very painful when they are administering. Some actually, when they get to the machine, they think, oh, they'll feel the radiation coming through their body. But radiotherapy is painless. You cannot see it. You cannot even touch it. You cannot even smell it. So it's a non-invasive treatment. And some patients fear, they think that when you go for radio, you are going to get worse or you are going to die. But that's not the truth. Radiation has healed and continue healing a lot of patients with cancer.
Since I don't need the light now, I'll take my gantry, this is called gantry. Yeah, so we have a gantry here. The gantry is the one which it can rotate in whichever direction. Eh? So, yeah, it can also go down. Yeah. It can also go down to whichever position. Now I'm taking it to 90 degrees. 90 degrees, we call it a left lateral. It's a true lateral. 90 degrees. And then I'll also snatch you the light again so that I can get my field. If you can see, this is my treatment area. You can see that's my treatment area. The field will come up to here. Yeah? This is the lower edge of the field. This is the shielding block. Yeah? They are so thick. Yeah, because they are made of lead. Lead as a metal. So what we do, we shield the eye. Yeah? And then we shield the brain. Yeah. Yeah. So
this one prevents
radiation from falling. If you shield the eye, it prevents radiation from falling on the eye. If you shield the brain, it prevents the radiation from falling on the brain.
So
Yeah?
then the radiation is only limited to the area that you have marked.
Exactly. So this is one of the fields. There's a left lateral. And then I'll treat the right lateral. Yeah? Because you see the tumor is on the midline. So we have to treat on the opposing side so that if you are giving 1 gray from this side and we are giving 1 gray from this side, you see both sides are receiving equally. And then we have things called nodes. Yeah? The nodes, the lymph nodes. So we also have to treat the lymph nodes. After treating the 2 laterals, this side and this side, now we'll take our gantry. After treating this side, we take our gantry on the other side. That's 270 degrees. That's very opposite to 90. And then after treating that, we'll treat from the anterior. Yeah? by leaving the gap of the upper field and the lower field 0.5 centimeter gap. Yeah? So that we don't irradiate double or get a hot spot. Yeah? Hot spot is whereby you irradiate more than necessary. So we'll come to 0. Thus we are treating the anterior field. Our intention of treating the anterior field is, you know, with this we have managed to treat level 2 nodes, level 3 nodes. Now we want to treat level 4 nodes. Yeah? The importance of getting the positioning and the marking accurately is because you want to radiate the same point every day. Yeah? So that the same point, so that you don't move away from the simulated area. One is because any centimeter or deviation can lead to irradiating the critical organ, like an eye or the organ that we don't intend to treat. Yeah? So you have to be perfect, especially when getting the setup right. Yeah? And the error might be 0.5 centimeter deviation. Yeah? That's acceptable, 0.5. But you make sure that you don't deviate from the simulated area at all.
Health Digest takes a break, and when we come back, we'll continue with this discussion of radiotherapy in treatment and management of cancer.